Good day. This is the training for the CSP 596 case report forms made for the study expansion. It is highly recommended staff review the operations manual and associated appendixes before taking this training as to better understand the material. If you have any questions or need a further explanation, call or email the National Study Coordinator, Neil Johnson, and the CSPCC Project Manager for CSP 596, Michelle Johnson, and we'll do our utmost to assist you. I'd like to introduce you to Joe D. Veteran. Joe D. Veteran has recently had a recurrence of CDI. He was pre-screened eligible by Site Coordinator Sally and Dr. LSI. After being informed about the study, he agreed to participate in the study. Dr. LSI and Site Coordinator Sally worked together to complete Joe's baseline visit. At the baseline visit, these following forms are required. Form 0, Contact. Form 01, Screening and Eligibility. Form 2, Randomization. Form 3, Demographics. Form 4, Medical History. Form 5, Physical Exam. Form 6, the Modified Horn Index. Form 7, Laboratory Assessment. Form 8, Concomitant Medication. Form 12, Patient-Centered Outcome Questionnaire. And Form 92, the Stool Sample Test Results. You will also complete as needed Form 13, Adverse Events, Form 14, Severe Adverse Events, Form 15, Adverse Events and Severe Adverse Events Follow-up, and Form 16, Protocol Deviation. So we don't expect this to be common. Now you should be seeing a sample of the form completed for Joe D. Veteran. This is Form 0, Contact Information. I have it right here entered in that it's visit 1 since this is baseline visit. I have selected a random site number, and he is the very first participant of this site. The randomization or call has already been done, and we have entered in his alpha code, and the visit date was as of New Year's of 2018. All this information can be collected in advance from using the participant's contact information in CPRS, but I do recommend that you confirm all this information when the veteran is actually here, so you can confirm that everything is correct and you did not miss anything. Also, if anything on the contact information does change, you can update this form as shown right here, where it indicates yes, updated contact form. And just so you know, all this information is completely made up. We put in his emergency contact information of Joan B. Veteran, his wife. It is useful to make sure that you have an alternate contact just so you can try and reach them and to also provide assistance in keeping in contact with the participant. You want to keep in all other associated information, and then it should be signed at the end by Site Coordinator Sally. The next form that was completed as baseline visit is a screening and eligibility. We have his information here that's taken on the header information that was taken as well. It's the same as the other one. And this basically goes over the inclusion-exclusion criteria. Basically, for participation, all of these should have been yes for the inclusion criteria. The participant is signed and written informed consent. The participant is 18 or greater years of age. They have a confirmed current diagnosis of CDI, determined by having a greater than 3 loose or semi-formed stools over 24 hours and positive stool assays for C. difficile. The current episodes represents the first recurrent episode of CDI within 3 months of completion of treatment for the primary CDI episode, and a participant that has not had an episode of CDI for 3 months prior to the primary episode, or a second recurrent CDI episode occurring within 3 months of completion of treatment of the first recurrent episode. So basically, a patient, once you have a first occurrence, you'll keep track of that patient for 3 months afterwards. As long as they're within that 3 months, then they have a recurrence of another episode, that is considered a recurrence. If they're over the 3 months, any episode after that would be a new first occurrence, and they'd be tracked from there. For a female childbearing potential, participant must have a negative pregnancy test at screening and must not be nursing. In this case, Joe's a man, so we have that checked off specifically for non-applicable. Next is exclusion criteria. All these must be no to be eligible. Unable to take oral capsules. Our medication for the study is only an oral capsule, so intravenous medication cannot be taken. Receipt of 72 hours of antibiotics considered effective for the treatment of CDI. Presence of fulminant CDI, including severe hypotension, severe ileus, GI obstruction, or a insipid toxic megacolon. Just to go back for this first one, receipt of 72 hours of antibiotics effective for the treatment of CDI. It's always an advantage to make sure that you're trying to approach the patients as soon as possible. The 72 hours, it gives it a window, so if they are discovered on a Friday night or on the weekend, that you will have a chance to still see them. But the longer the time period passed, the less willing the patients will likely be to want to enroll in the study. Number 9, receipt of more than one course of oral vancomycin, more than one course of fidaxomicin, and more than one course of vancomycin followed by a taper impulse since the primary episode of CDI. As long as you are giving the patient in the first recurrence, this will not matter. This will only come into effect at the second recurrence. Because to use an example, as say at the first recurrence they took vancomycin, and the first recurrence they took vancomycin, and the first recurrence they were started on vancomycin, but they haven't reached over the 72 hours. That's not considered a full course, so that does not count. So they are still eligible for the study. They would have to be a situation where they had a first occurrence, they had a recurrence, and they weren't interested, and they had the same medication, and then they would not be eligible if they had a second recurrence. They can't have a known allergy to vancomycin or fidaxomicin, though it is recommended that if you do see this, to check a little deeper. We have seen a circumstance where the patient was diagnosed with having an allergy to vancomycin, but it was turned out that it was red man syndrome, and it was determined that they were able to participate in the study. Acute or chronic diarrhea due to inflammatory bowel disease or other causes that would confound the evaluation of response to CDI treatment. If we're not able to properly measure their diarrhea or in their stool, we cannot track how well the medication has done for them. Anticipation for need for long-term systematic antibiotic treatment beyond 7 days. Again, if they're on another antibiotic treatment, it's going to persist past 7 days. We won't be able to tell if they are getting better due to the study drug or due to the other intervention. Participant is participating in another clinical trial with an active drug intervention. And finally, we would say that the participant is eligible for the study. The next form is randomization. Participant has signed and dated the informed consent form and has been given a copy of the consent form prior to the initiation of any study procedure. Participant has signed the HIPAA authorization prior to the initiation of the study procedure and have been given a copy of the HIPAA form, and participant satisfies the study inclusion criteria and is eligible for the study. These should all be checked yes. The only reason any of these would be no is if this turns out to be a mess randomization, when that would be a protocol deviation. The next form that would be completed is demographics. Again, this is information that can be begun before the participant even shows up, but you do want to confirm all this information with the patient when they actually do come in. It include the age, ethnicity, race, military history, branch of the military, service period, and all these forms also contain a comment section. If there is any kind of issue or any kind of information that is a little out in the normal or the form doesn't capture, it can be put in the comment section. That way you're keeping record of anything that might be happening outside of additional information. Also, if you do encounter any confusion or any difficulty when completing these forms, please refer to the instructions for these forms, which can be found in the operations manual appendix. The next form is medical history. Does the participant have any history or medical conditions or surgery history involving cancer, diabetes, hypertension, heart disease, abdominal surgery, other medical conditions specified, and other surgery specified? The previous CD history, this first answer should only be 1 or 2, depending on whether this is a first recurrence or a second recurrence. If this is the second recurrence, you'll complete when the second previous CDI episode is, but it's not necessary otherwise. You'll list any antibiotics that were used for the prior episode. This does not include any medication that they happened to have taken before they became part of the studies, as long as it was under 72 hours. Now, if they did take any medication within the 72 hours before they started to participate in the study, you'll put this information here. Joe did not take any medication. We were able to get to him right away. And then you also list that they're being treated with any systematic antibiotics during CDI therapy for greater or equal to 1 day. And antibiotic medications used for other reasons other than CDI in the last 3 months. The next form is the physical exam, which will be completed by the Dr. LSI, though the vital signs can be entered in by the site coordinator. Most of this information can be found off CPRS, though you do want to confirm this information with the patient when he is here as well. Physical exam is an evaluation of the overall appearance and other physical conditions of the patient at the time. The Modified Horns Index is Form 6. This will also be completed by Dr. LSI. And this is C. difficile infection is not considered a factor in calculating the Modified Horns Severity Index. It is only based on underlying diseases present at the time of CDI diagnosis. Underlying disease severity is rated on a score of 1 to 4 according to the investigator's clinical judgment, where level 1 is a low single mild illness. Level 2 is moderate, more severe diseases and uncomplicated recovery. Level 3, major complications or multiple conditions requiring treatment. And level 4, extreme, catastrophic illness, ultimately expected to lead towards death. Comments can be also put here to give any information that might be relevant or justification. The next form is the laboratory assessment. This can be collected either, so this information can also be collected prior to the patient has come, if they have had a lab assessment done within 2 to 5 days, or about 5 days for baseline, 2 days for other visits. They can be done before they actually complete, they can be done before they come in. You can although if the patient is willing, you should always order a test for them because the closer that we can get to the baseline or the actual date, the better. The site coordinator can complete all the information in the first 4 columns, but if any value is abnormal, the LSI must determine if it is clinically significant or not. Form 8, concomitant confounding medications. Basically, the site coordinator will list any medications that the patient is actively taking. If they stop taking it day of, it is not considered an active medication. You'll want to use CPRS to confirm this, to fill out this information, but you will want to confirm this information with the patient as well, as there may be a medication that prescribed but not actually taking. And any information will be put into these different categories. If a medication is changed in dose, you will indicate that the medication of the previous dose will have ended, and you will open up a new column indicating that they are starting the medication again with a new dose. It'll be treated as if it's a new medication. The medication unit code can be found here, giving information on how much the medication was taken, and the drug codes are listed in the form instructions, so you can find what the number will want to be used to identify the drug as far as the study is concerned. The next one is Form 12, Patient-Centered Outcome Questionnaire. This form will be completed given to the patient, and they will be directed to complete this form to the best of their ability. There are no right or wrong answers to these questions. All the questions are asked, or our answers are based on a Likert scale, which is a 1 to 5, which indicates severity, where, and for example, can be not at all, a little bit, moderately, quite a bit, or extremely. So you're going to be, it's asking their agreement with these questions. For example, in this situation, Joe was asked, have you had any difficulties or disruption carrying out your daily activities? Due to his CDI, has had some extreme difficulties and disruption carrying out his daily activities. If the patient does have any questions, try your best not to coach them. Just let them know that basically they should answer to the best of their ability and that there are no wrong answers. This will ask them questions based on their daily activities, their anxiety, their diet, their sleep, discomfort, coping with disease and health perception, the control of the disease, the impacts of stress, dysphoria, relationships and social reaction, and financial status. Also was listed as a form to be completed was Form 91 for stool collection. This form is actually in a form of an Excel spreadsheet, and basically you'll only be concerned with completing this lighter colored section here that is in yellow, as you will not do anything for this pink section. This will be completed by the lab group. This will be used to track stool samples that are collected, and also be used as a shipping manifest when sending out your samples to this core lab. In this, you'll put your site information, the participant ID, which visit the sample was taken for, and the date of the stool collection, and any other comments that are necessary. It is recommended that if the patient does take a stool sample, even though you're only supposed to do it at baseline or at recurrence, if something is taken for another reason, collect one and submit it as well. This core lab can always get rid of the sample if they don't need it, but they can't request it from you and get it from you if it's not available and wasn't presented in the first place. All right, that completes baseline. Now baseline is over and the veteran has gone home, and it's visit 2, day 5 participant call. It's 5 days after the baseline visit, and site coordinator Sally calls Joe for his scheduled visit 2, day 5 participant call. Site coordinator Sally asks Joe how he's doing, if he is taking any new medications, and about the stool diary. Joe feels he's started to improve and has not been taking any new medication. Joe and site coordinator Sally review the stool diary on the phone, and Sally takes note of his responses for her own record. Site coordinator Sally finishes the call reminding Joe about the clinic visit in 5 days, to which Joe confirms, and Sally promises to remind Joe the day before as well. Forms required for visit 2, day 5 call. Form 8, concomitant medication, and as needed. Form 13, adverse events. Form 14, severe adverse events. Form 15, adverse events, severe adverse events follow-ups. Form 16, protocol deviation. Form 17, missed visits. And Form 18, early termination. We'll only be looking at the forms that are bolded in this, just because some we've already gone over and won't need to be, or if in the cases that add needed forms, we'll be going over them later in the presentation. Now, Form 8, concomitant medication, is a form that you've already seen, but there are some changes on this. This needs to be completed at all visits and uploaded. That way we can count that there has been a visit happening when there is a call. So even if there is no change, you still want to complete this form at each visit and resubmit it. As you can see up here, this is visit number 2, and it has the site information and ID, and it has been 5 days, reflecting that it is now the 6th of January. There's been no change to this medication, so there's been no new information added on. Visit 3, day 10, clinic visit. Jody veteran shows up at site coordinator Sally's office for his visit 3, day 10 appointment. Dr. LSI also comes by to conduct the assessments, and Site Coordinator Sally completes all required forms. Joe feels much better and is happy with his improved condition. Forms required for Visit 3, Day 10 clinic visit. Forms 5, physical exam. Form 7, laboratory assessment. Forms 8, concomitant medication. Forms 9A, diary summary, day 1 through day 10. Form 10, treatment failure assessment. Form 12, patient-centered outcome questionnaire. As needed, Forms 13, adverse events. Form 14, severe adverse events. Form 15, adverse events, severe adverse events follow-up. Form 16, protocol deviation. Form 17, missed visits. And Form 18, early termination. We'll be skipping physical exam, laboratory assessment, concomitant medication, and the PCO questionnaire because you already saw all those forms at baseline. The first one is the diary summary form of day 1 through day 10. Visit has been changed to visit 3, and the date has been also updated to reflect this. You first start by indicating the date of their first dose and record the number of capsules that was taken each day. All of this information should be based off of the study participant's stool diary, which he should bring with him at each visit. The site coordinator is recommended, though, to take notes every time the patient or the site coordinator contacts and talks to the participant. That way, in case the participant forgets the form, forgets the stool diary, or loses it, not all information is lost, and it can be used as a reminder to help the participant recomplete the information. Did the participant return the medication card? Yes. There were 2 pills that have not been taken yet since this is day 10, and they hadn't had a chance to take them since an afternoon visit. Was the participant instructed to miss any doses? No. I do want to clarify that the participant is going to be still completing these 2 doses and taking the card with them. Their bowel movement history, the number of bowel movements, the number of loose or watery bowel movements or diarrhea, and did the participant have 4 or greater loose or watery stool diarrhea. Did the participant have any discomfort or health concerns for days 1 through 10? Yes. And then you'll indicate from the different levels. It'll be 0 for the days when there are no health and discomfort and none of this other information needs to be completed, and 1 for the days when there are any kind of discomfort reported. Joe had some abdominal pain, which reduced, and some bloating, and urgent need to have a bowel movement. Form 10, treatment failure assessment, day 10. Symptom resolutions, day 1 through 10. Did the participant develop worsening symptoms, increase in informed bowel movement, over 24 hours severe abdominal pain, development of hypertension, shock, ileus, toxic megacolon as judged by the site investigator during treatment compared to baseline that required to stop the study? No, so the patient is continuing. If the participant doesn't show any improvement, it'd be considered a treatment failure and they would be withdrawn from the study. To clarify the difference, if they do show some improvement, but then have a recurrence even after the improvement, it is not a treatment failure, it is a recurrence. Usually this would happen after day 10, but it is possible for it to happen before day 10. So make sure you consult with the LSI and with the national coordinator in the chair's office if you have any questions about this. Did a participant resolve diarrhea symptoms and achieve 3 or greater unformed bowel movements for 24 hours for 48 consecutive hours through the end of day 10? Yes, they did. And first day of no diarrhea, which would be days of the 3rd. Just to clarify, when it says no diarrhea, it is indicating no diarrhea of significant amount. So even though they had diarrhea on loose or water-free bowel stools, only 1 on this day, because it was not 4 or greater, this counts as the first day of no diarrhea. Number of unformed bowel movements on 24 hours on day 10, and they're considered a treatment success since questions A1 must be no and A2 must be yes. Were there any worsening of symptoms? And you'll complete this to indicate if there are. if they're. And as always, concomitant medication must be completed at each visit. And hold on, I've skipped ahead. All right. Next is visit 6, day 31 clinic visit. Obviously, they've had calls in between this. Joe ended up not showing up for his next scheduled clinic visit. A few days later, Joe calls site coordinator Sally and lets her know that he was admitted to the hospital for sepsis from a UTI and missed the appointment. Site coordinator Sally and Joe rescheduled the visit to a later in the day, but unfortunately it still falls outside the window for that visit. Joe comes in when promised, and the visit is completed as normal. Joe also lets Dr. LSI and site coordinator Sally know that his doctor wanted him to start taking ciprofloxacin for the urinary tract infection. Forms required for visit 6, day 31 clinic visit. Form 7, laboratory assessment. Form 8, concomitant medication. Form 9B, diary summary, days 11 through 31. And as needed forms, which will be, in this case, Form 14, severe adverse event, Form 16, protocol deviation, Form 17, missed visit. Now, just to show you, the site coordinator started this, but this is not required because Joe did come in and complete the visit, so it is not a missed visit. It's only a missed visit if the visit was unable to be completed even after outside the window. Laboratory assessment is required for this, but I am skipping this as we have already previously gone over this form. Visit 6 has been up, since this is visit 6, it's been changed to that, and the date reflects this. The date also indicates, if you were to do the math, that this is a bit later in the week because he wasn't able to come during the window. They've been started to take this medication, so it has been added to the list. He's taking, you have the medication dose, unit code, and the drug code. He's going to continue taking this for the remainder of the study. Even though we have gone over Form 9A, 9B is different as the stool diary does change over time. So this is the diary summary for for days 11 through 31. Past day 10, the diary becomes more condensed to make it easier, and basically multiple days, it does a week at a time on each page, as opposed to 1 through 10, where each page is a day. On this, record the number of capsules a participant took each day. Right now, they'll be on their second dose, so they'll be either on to the taper pulse or the placebo. Did the participant return the medication card? Was the participant instructed to miss any doses? At past day 11, it just asks if they've had greater or equal to 4 loose watery stools. The exact amount is not asked anymore. Discomforts and health concerns. Did the participant have any discomforts and health concerns? If so, this will be completed in the same way as the previous version. Since there was a hospitalization, the severest adverse event occurred, which has to be reported. SAE suctions must be completed and submitted within 72 hours of site personnel becoming aware of the SAE. All SAEs regarding a relationship to the study drug will be recorded on this form. To clarify that, the 72 hours starts of when you actually learn of the event happening, not from when the event actually happens. The date the SAE was reported, the SAE start date, and the date the site have become aware of the event. So this will be when the actual information is submitted, when the SAE actually happened, and when you actually became aware of the SAE. Date last study drug was taken. You'll then do the type based on, put the type of the information on this. In this situation, inpatient hospitalization or prolongation of existing hospitalization. And SAE reported, so participant was treated for sepsis at hospital. Describe the serious adverse event. I'm not, basically, since this is made up, I'm not including this information, but this should be included for any SAE that actually happens. Then the outcome, they recovered and it was resolved, and the date, the resolution, the patient was able to come in because they improved. And this was not previously reported as a non-serious AE. With the combination taken at the time of the SAE, they were prescribed for treating this SAE. Any lab test results, again, this was made up, so there are no lab results that are associated with this, but you will include any lab results there. And action taken within the study. This is not considered related to the study. This is a determination that will be done by the LSI, and the chair's office can be contacted for advice as well. Is this SAE reasonably attributed to study drug? Not attributed. Is SAE attributed to progression of the disease being studied? Not attributed. Did the SAE cause discontinuation from the study? No. If yes, complete Form 18 termination form. Did the LSI submit the CIRB Form 119 to the CIRB as an expedited report? Yes. Major SAEs need to be reported to the CIRB as well. And Dr. LSI signed this, and Site Coordinator Sally helped as well. Because the visit happened outside the permissible window, there is a protocol deviation. This was beyond the control of the study team, but it still needs to be measured. In this case, follow-up visit outside permissible window. As I said, Site Coordinator Sally started to complete a missed visit form, but it was not required since the Joe, the veteran, actually came in and completed all the visit information. Basically, what will happen is once the window for a visit happens, you will get a quality check report repeatedly until you complete a Form 17 missed visit, letting them know that there was a missed visit for that day. So if you do know that the patient will be coming in a little late, it is fine to ignore those quality check reports because they will stop once the form's been entered into SharePoint, or excuse me, uploaded to iDataFax. Unscheduled visit for reoccurrence. A few days later, after Joe's visit 10, day 59 clinic visit, Joe calls Site Coordinator Sally to let her know that he had significant diarrhea, greater than 4, each day over the last 2 days. Site Coordinator Sally asked Joe to come in to provide a stool sample to be assessed for reoccurrence of CDI. The results of the stool test come back positive, and after discussing it with Joe, Dr. LSI decides that Joe has reached study endpoint and should be returned back to the care of his primary care provider so he can be treated for recurrence of CDI. To clarify, this is an unscheduled visit for recurrence. It's sometimes just called an unscheduled visit, but the recurrence is the important part. You do not need to complete this or any of these forms just because the participant shows up at the hospital an unscheduled time. Forms required for an unscheduled visit for recurrence. Form 5, physical exam. Just in regards to Form 5, physical exam, past day 10, the physical exam is not required if the LSI determines that there is no reason to continue it based on the patient's condition. Though if there is anything that should be examined, it should be continued at all the scheduled times. Form 8, concomitant medication. Form 9, diary summary can be B through D depending on when the recurrence happened. And Form 11, diarrhea and CDI recurrence assessment. And as needed, you'll be completing Form 18, early termination. Diarrhea and CDI recurrence assessment. Unscheduled visit for recurrence are always considered Form 98. You'll notice that there is a .0 behind each of the other dates. Now, this is only applicable for unscheduled visits for recurrence. All the other ones will be 6.0, like in the example here. The reason that this could be applicable for unscheduled visit for reoccurrence are have been circumstances where a participant does have a recurrence of diarrhea, and they come in, but it's determined that it is not a recurrence of CDI. It may have been related to another condition, another sickness, food they ate, or anything like that. And after discussing it with the LSI, the participant in the LSI decided to continue the study. If that is the case, then you will count that one time as unscheduled visit for reoccurrence 0, and any following unscheduled visit for reoccurrence after that will increase procedurally. So the next one would be 98.1 if another one happens. Please complete this forms now this form, it will be completed usually on visits 7, day 38, visits 10, day 59, visits 15, day 90, and unscheduled visit for recurrence. This is basically assessing them for if they've had a recurrence of diarrhea. If this happens at any of the other times, it's not really expected to have a positive result be for diarrhea unless they happen to have their reoccurrence at the same time when they have their normal appointment. If they do have if they do have a recurrence of diarrhea when they would have their normal appointment, it then turns into an unscheduled visit for recurrence. Recurrence of diarrhea since last visit after day 10. The participant experienced recurrence diarrhea, greater forward bowel movements. Yes, they did. They had it on the 2nd of March. And their last visit was on the visit 10 on day 59. Other symptoms and complications since last visit after day 10, the participant experienced other clinical events, including severe abdominal pain, toxic my colon, collecting or death. Joe did not experience any of these things over that time. Recurrence of CDI last visit after day 10. If the answer to question 1, A1 or B2 is yes, was CDI confirmed by the stool assay or his presence of a pseudomembrane? Yes. If answer to question A1 or B2 is yes, and the response to C3 is no or not done, the CDI test is negative, or the CDI test is not done with diarrhea, recurrence, or other symptoms, complications occurred. Was the participant treated for diarrhea or other symptoms, complications with vancomycin, metronidazole, fidaxomicin, or another drug indicating they were retreated for CDI? If this is no, continue to follow the participant until the next recurrence. As I said, they could continue to study. If yes, withdraw the participant from the study, submit Form 18 termination, and list medication used. Form 18 early termination. Again, this is for unscheduled visit for recurrence, date of participant's last visit, clinic or phone call. So this would be the day 10 one as listed above. The reason for early termination, they achieve symptom resolution in the first 10 days, mark success, but experience recurrence of diarrhea, CDI prior to day 90. All right, that is all the information on the CRFs of a patient going through them from his baseline visit all the way to proceeding out the study. Of course, this will happen in different combinations for different patients, and you can also see additional information for all these forms in the instructions that are listed in the operations manual appendix. Again, if you do have any questions regarding this material or need further explanations, call or email myself and Michelle Johnson, and we'll be happy to assist you. We look forward to helping you with your patients in the future, and take care.